Hey everyone, Brandon here, registered nurse for the United States, living and working in Sweden for the last 3 years. Wanted to do a video about bullying in the nursing field. Why does it even matter? Why should you care? Well, as a patient, it could affect your safety and your outcomes in the hospital. Let's talk about it. Just a little bit of background information about me so you kind of get a feel for who I am. I am a registered nurse with over 15 years experience, mostly in the United States. I worked in many different departments. I worked in ICU to start with. I also worked in telemetry. I became a float nurse. I've worked in diabetes as a specialist, and I eventually got my nurse practitioner, so I was able to have the authority to prescribe medications. I moved to Sweden during the pandemic about 3 years ago, got my nursing license here and the equivalent of a nurse practitioner license in Sweden, and have been living and working here in Sweden since 2021. I thought it was an interesting conversation that kind of came up in the workplace the other day. A lot of colleagues that I work with are real curious about how things are in the medical field in America. And so something that came up during our lunch discussion one day was about bullying in the workplace, bullying among the nurses. And so I thought it'd be an interesting thing to talk about. This is going to be a bit more of a podcast type video. I haven't really rehearsed anything. I do have a few ideas in mind I want to kind of discuss. And so basically what I'm going to be talking about, first of all, I'm basing this off of an article. I did a bunch of research on this. I don't want it just to be purely anecdotal information, but I want it to be based off of stuff that's out there. And I was shocked how much information there is out there on bullying in the nursing workplace, in the nursing field, amongst nurses towards each other. In fact, there's even an expression called nurses eat their young. And I heard about this like almost 20 years ago when I was studying to become a nurse. And it's pretty shocking, and it's still going on. It's been going on for pretty much the entire history nurses have been here. So if you want to get a look at the article, here's the article that you can take a look at. And it's in pretty good detail. There's a lot of cross-referencing to other articles as well. So it's a pretty well-researched topic. So first off, I want to talk about what nurse bullying is, and then what my experience has been with bullying in the nursing field. And then my experience in Sweden. Do they have a problem with bullying in the nursing field here in Sweden? Then I want to kind of talk a little bit about some of the strategies that are out there to deal with this. This bullying culture contributes to poor work environment, increased risk to patients, which is why I think it's so important that you as a listener know about this. And I think it's important that we bring awareness to this because this problem is not going away. It's been around forever, and I think something needs to be done about it. Here in this study, we see also that it costs the average hospital $4 to $7 million a year because of nurse turnover, because people are just not happy. They don't stick with their profession. They go into something else, or they change hospitals that they work for. So as I mentioned earlier, there's this term, eating our young. And this is something that I heard about when I was a new nursing student in schools. They talked about this and they said, be prepared for this. So what does it look like? Well, there's a whole lot of terms that are used to describe this. There's horizontal violence, lateral violence. That was one I actually heard about when I was a newer nurse, was lateral violence. And here, the American Nurses Association defines nurse bullying as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. So this is really serious because it threatens patient safety, nurse safety, and the nurse profession as a whole. So this is a big deal. One thing I was kind of shocked, I haven't actually witnessed this myself. It says here that bullying can run the gamut from incivility, exclusion, physical violence, and death threats. I have not been the victim of death threats except from my patients. I haven't experienced it as a nurse, but apparently according to this study, it does happen. So what does this bullying look like? Well, according to this article, there's covert and there's overt. It could be passive-aggressive. It could include rumors and gossip, withholding information, unfair patient assignments, giving people undesirable tasks as punishment, sabotage, microaggressions, denigrating another person's race, religion, or membership in another marginalized group. Those are all different forms of bullying. And now in the age that we're living in, it can even happen in the social media world as well. So who's doing the bullying? It could be young nurses that they're considered novice nurses, so they've got like 2 years experience, and then all of a sudden they get a God complex, and then the brand new nurse comes in, and then they're picking on the new nurse. It could be older experienced nurses. It could be charge nurses. So this was interesting here, talking about the different nurse bully archetypes: the super nurse, the resentful nurse, the PGR nurse, which uses put downs, gossip, and rumors to bully other nurses, and is often quick to take offense to a neutral remark. Backstabbing nurse, green with envy nurse, cliquish nurse. I have seen all of these. According to this article, bullies often lack self-confidence and may see certain colleagues as threats. Some may worry about younger nurses usurping their place in the hierarchy, and others can feel threatened by their elders' competence and experience. So why does it even matter? Well, like I said, it affects you as a patient. So if you're in the hospital and your nurse is being bullied, it can affect the care that you're getting as a patient. If it gets as far as, for example, sabotage, you can have a nurse that goes in and sets up a nurse for failure, but just to kind of like make them look bad, and then that can affect your safety as a patient. If a nurse is being bullied, they may not be thinking clearly. They may be affected mentally and emotionally, and so they're not thinking clearly to be able to take care of you. Nursing is already an extremely high-stress area to have to work, especially if you're talking about the emergency room, the intensive care units, the operating room. All the nursing units are stressful, but these units, you're talking about people that are very sick and very unstable, and things can go bad really, really quickly. So as a patient, you would want to make sure that the nurse has the prerequisites to be able to function their best. So this is a big deal. Not only that, I actually have colleagues that have taken their lives due to depression that are nurses. It was a shock with most of them because you had no idea it was coming. But you saw that these people got bullied in the workplace. You thought that they took it really well and that these were very strong personalities. But apparently these things had a cumulative effect and they just couldn't take it anymore. So that was always a hard thing when you're getting that phone call that, yeah, so-and-so is not coming into work because they took their life. Another big deal is the turnaround of nurses is pretty bad now. It's kind of been that way for a while, but it seems to be getting worse and worse, especially since the COVID pandemic. Nurses are more stressed than they ever have been. People are going into other careers. I have quite a few friends and colleagues that have been nurses for 15, 20 years, and they're going into completely different fields because they don't find nursing fulfilling anymore. It's impacting their health, their physical well-being, their mental well-being. And so they're deciding to go into other things. And this is a big problem because there is what's called, I think it's something like the 2030 crisis, which is basically when all the baby boomers are going to really be needing a lot more care. And if we don't have enough nurses to be taking care of the baby boomer generation, we're in a big problem. We're already short-staffed. We're already having very high patient-to-nurse ratios and patient-to-doctor ratios. And so if this continues on and things don't get better, this is going to create a serious problem. So we've got a report here that's saying that improving nurse work environments may improve the patient experience and the quality of care. A better nurse work environment has also been linked to lower risk of deaths and better outcomes for patients. And I think what you're seeing is these hospitals are trying to offer nurses higher and higher salaries to keep people, because the people just don't stay. And another thing that I've noticed through the years is if you stay with a company, I stayed with a company for 16 years, and the raises are terrible. But then you get a nurse that comes in that's only got a couple years experience, but they're coming from somewhere else, and then they are offered more money than you who's been loyal to that company. And then you're also having to deal with all the problems there, the short staffing, the bullying. And according to this study here, they found that nurses felt that bullying impacted job satisfaction even more than salaries. The average cost of turnover for a nurse is between $38,000 to $61,000. So if hospitals were using their brain and thinking a little bit more long-term, they would realize that they need to create a healthier work environment to be able to save money. When you're talking about a hospital that's got hundreds of beds, this goes into the millions of dollars. A lot more money is lost too, because then people are calling in sick because they just don't want to have to go and have to deal with the bullying at work. And so they call in and say, yeah, I just don't feel good. I'm sick, and I can't come into work. And so now you're even more short-staffed, which can lead to an even more toxic work environment. And unlike in a lot of other countries, in America, education costs a lot of money. And so a lot of nurses have paid thousands of dollars to become a nurse. It was something that they really felt that they wanted to do. It was something they had a passion for. I have a lot of colleagues that went to a very well-known nursing school, and the average that they were paying for a bachelor's degree was $100,000. And it takes a long time to pay that off. A lot of them, even after 10 years, were still paying back these student loans. So a lot of time and blood, sweat, and tears has been put into becoming a nurse, and then only to come into this profession and then realize that it's a toxic work environment for many. Okay, so what's my experience with nurse bullying? Well, I can say that I have experienced it. Now, another disclaimer, I have autism. I did not know I had autism. I got diagnosed later as an adult because of things happening in the workplace were affecting me so much. And it took several years to get the diagnosis, but that's what eventually ended up happening. Now, I had some mannerisms. You don't really see it on the camera because I go to a lot of trouble to kind of control myself. I do a lot of editing to take out my autistic mannerisms. I do talk kind of monotone sometimes, and it takes a lot of energy for me to put feeling into these videos, so it's really hard for me. I know some people say, oh, I hate his voice, or it's so hard to listen to him. But the thing is, I am autistic, and I can't really do anything about that, so you get what you get. But I have a problem with tics, especially if I'm stressed. And so I worked in the ICU, and I was really good at my job. I was having most of my patients would say, hey, I want to have Brandon back as my nurse. So it wasn't affecting patient care. In fact, people wanted me to come back because they liked me, loved my patients, loved what I did. And I remember a nurse telling me, and this is a nurse with 16 years experience, says about my tics, because I would do this thing with my neck and my shoulders and my face, like twitching. And she says, you need to stop doing that because you're going to scare your patients. They're going to think you're not confident, you don't know what you're doing. She just kind of like tore me up. Ironic thing, I talked to her 2 years ago, because when she said that to me, that was a long time ago, over a decade ago. She's not a nurse anymore. She's gone into, she sells things on Etsy or something like that. So it's kind of funny because she had her own issues and she was taking things out on me. I also can tell you about a specific experience of something I went through. So when I was a brand spanking new nurse, I got a job in the neurological ICU. And so my preceptor, I remember my first day as a brand new nurse. This nurse with 25 years experience is my preceptor. And she was so passionate about it. Her whole life was this job. And honestly, if I was a patient, I would want, if anyone took care of me, I would want her to take care of me. She's the best. But there's a dark side, and that was she bullies. Well, I don't know if she does it anymore, but back then she would bully people, and I was the victim of it. And she would always come off, it was very covert. So she wouldn't yell at you, raise her voice or anything. It was a lot of kind of like backhanded things happening. So my first day I show up on the unit, she's like, okay, so today's your first day. I'm a brand spanking new nurse. I hadn't really done a lot of work in the ICU. I've been working in the trauma ICU a bit, but not in the neuro ICU. And so there was a residency program that I got into. So it's basically like 5 months of training. I'm supposed to be with a preceptor getting trained to work in the ICU. So my first day, she gets our patient assignments. So we got 2 patients. We get the sickest one on the unit and then one that's not so sick. And then she says, well, we'll give you the easy one since it's your first day, just so you can get used to where everything's at and all that kind of sort of thing. And then we'll build up from there. But we need to check on the other one because they're really sick. So we check on the other one. We walk in the door. And then as we're going through the door, she looks at me. She says, what do you think about this? And I look at the patient, and there was like 12 IV drips. I guess like 3 or 4 pumps, because you can have like 4 channels, I think, on one pump back then. She had bolts coming out of her head. She had drain coming out of her head. She had chest tubes. She had a tube coming out of her nose. She was on a breathing machine. Her eyes had swollen so much that they had to put gauze on her eyes to keep them from drying out because the lids wouldn't close. So it was like wet gauze. And I kind of look at her, and she's like, what do you think? And I was like, yeah, it's a little intimidating. She goes, okay, we're going to baptize you by fire. Okay. And she goes, get the patient ready for surgery. We're going to do surgery right here in the bed. We've got 2 surgeons coming. One is going to place in a trach, and then the other one's going to put in a PEG tube, and they're going to do it at the same time, and you're going to push drugs. I'm like anesthesia. And I'm like, I was okay. I kind of survived. She later told me that day that she thought I was really calm and I had it together. And she was teasing me because I was drinking. I had like this herbal tea, and she's like, man, what's in that herbal tea? Because you're like so calm. I don't know how you can just stay so calm like that. So, a couple of weeks goes by, and she says, you really don't need to be with me. We hired you for the night shift. We're working day shift. I think you're ready to go onto the night shift. So I want you to pick out when you're going to work. And so I was trying to be very accommodating. And so I said, well, what do you recommend? I was trying really hard to be a good employee and just be willing to do whatever. And she's just like, well, no, it's you. It's your work-life balance. You got to think about that. So I was like, okay. So I said, how about Monday, Wednesday, Friday? Well, actually, I think I said 3 days in a row. And she's like, well, that might be too much to do back to back. So she's like, because they're 12-hour shifts. She says, are you sure? Do you want? I said, okay, Monday, Wednesday, Friday. Because then I thought I can work a 12-hour shift, have a day off and rest, work a 12-hour shift, have a day off and rest, work a 12-hour shift. Next thing you know, it's like my first week to do the night shift. So I'm trying to get used to that. And I get a phone call from my manager and says, they're considering firing me. I've only been there 2 weeks just in training, and they're already talking about firing me. I was totally shocked. She says, you need to come to work now. And I'm like, what? I got to work the night shift. So you want me to come in? You woke me up in the middle of my sleep. You want me to come in for this interview to talk about firing me and then go back home and sleep for 2 hours and then come back to work again? So anyway, I went up there, and then come to find out what it was is that same nurse that was supposed to be precepting me went behind my back and was talking with the nurse that would precept me on the night shift. And they started complaining about that I'm going to work Monday, Wednesday, Friday, which was the agreement. I was willing to do whatever and work whatever shifts. I had no issue with it. And so I had to explain that to the manager. I said, it's not a problem. I said, and I told her exactly how everything kind of went down, and that I was in complete shock. I said, I'll work whatever days you want me to work, So it worked itself out, and I ended up being there for 3 years. But it was just things like that. Now, thankfully, I did not get bullied really often on that unit. I just kind of did my thing, kept to myself. But those are just a couple little things that I saw. But I saw it a lot with other people getting bullied. But I would say the vast majority of the nurses where I worked, I didn't see bullying, but there were those. And then I went on to become a float nurse, and I really didn't have a whole lot of issues after that because, things were pretty good. People were happy that I was coming to fill a need. A nurse would call in sick, or, they get slammed with a huge patient load. So then I go and help this unit that really needed help, and I'm getting paid good money. It was great. However, I did go and work in the trauma ICU unit one night, and I hadn't been there in years. And they gave me a really bad patient load, and I was all the way at one end of the unit all by myself, and I didn't have any support. And then they basically set me up for failure. I don't need to go into any details on that, but I'd never been written up ever before. And this unit, I've never been there. I came in on a day off because they're like, we really need help. You come in to help them out. It's not even your normal unit. And then I got thrown under the bus. And I was having to deal with a gang that was trying to come in and finish out the job of the patient that didn't die. That was, another gang member, some drug deal thing with cocaine or whatever. And so I'm having to deal with that. And I got another patient trying to pull out his chest tubes. And I'm on that end of the unit all by myself with all the other patients on the other end. And they're all over there just chit-chatting and on Facebook and everything like that. So I told my boss, I said, I will never work on that unit ever again. It was the worst experience I've ever had. I felt very unsafe, and then they're just going to throw me under the bus like this. So you have to stand up for yourself. You have to advocate for yourself. And thankfully, I have a fantastic manager, and managers will make or break a unit. And I had a manager who was just absolutely amazing. My sister eventually became a nurse and ended up working for her as well. And she was great. that's what I have to say about that. Then I went on and got another job. And at this time, I was going to start working away from the bedside because I had a back injury. And so with this job, it was more administrative, but I still had patient involvement every single day. Now, I'll probably do a whole little video on this on a separate occasion. And I don't have a problem talking about this because the person involved in this has since passed away a couple years ago. But the person was a micromanager, and she was not the manager, but she thought she was the manager. She was the coordinator, was the title she had, but she thought she's the manager. And so she was doing a lot of bad things that eventually got her terminated. And so, like, she would go in and she'd read all my charts that I was trying on, and then she'd go back, and she's very passive aggressive. She'd be like, well, why did you write that? And you should have done this. And well, why did you see, just like micromanaging everything. I'm like, we all do things differently. There's more than one way to skin a cat. I'm covering everything that needs to be done. The job is getting done. But like I said, it ended up resulting in she ended up getting let go, which was interesting because she'd worked there for 40-something years and helped start that department, and then she got let go. But she would do stuff like she would put her ear, I actually caught her putting her ear to the door when there'd be like a private conversation going on in an office, and then I'd come around the corner and see that she's listening, like trying to hear what's going on, and then she'd go, ooh, I was just, just listening, and I'm like, and then what it eventually led to was she ended up going into the patient chart of a deceased patient who was a relative of one of my coworkers. And then that's really what got her fired, because she was bullying. She was trying to say that, like, my coworker basically was making it up that her family member was sick. And so she wanted to try to find out if her family member really was admitted and really was sick, and then finds out that, yeah, not just was she sick, she died. And so it triggered some alarm bells, and security got involved. Now, what's my experience with bullying in the workplace here in Sweden? I really haven't had any issues. I would say I feel safer working here. I haven't really seen it so much. What I can say I have seen, and I hear from colleagues, we have a very large amount of people that work in healthcare that are not Swedish. And so what you see is there is a bunch of what I would call racism, and my friends who are nurses that are from other cultures, they feel it as being, that it's racist. You see this clash between not the Swedish people that work in healthcare, but you see people from other countries that are not from the Middle East versus people from the Middle East. You see a lot of bullying there because they don't like, for whatever reason, the people from the Middle East. So I have a really good friend who, he actually used to be a doctor where he comes from, and because of the war and stuff in the Middle East, he wasn't able to, like, all the documents are lost or whatever. And so, like, he had to go through school all over again. And instead of going to school to be a doctor because it just wasn't feasible, went to school again here in Sweden to become a nurse. Fantastic nurse. He would do all this extra stuff, worked really, really hard. Stuff that nobody wanted to do, he would do it way above and beyond the call of duty. Patients absolutely loved and adored him. We had several other nurses. In fact, we were kind of like the United Nations because, you had the American, you had some people from the Middle East, you had some Kurdish people. I mean, it was really fun. Everybody bringing a different food and culture to work and everything. But then we hired some people that come from another part of Europe, from Eastern Europe, and they got into management positions. And thankfully, I got out of that place. I don't work there anymore, but it has resulted in the people that stayed there feeling bullied because of their race. Like, I shouldn't say too much because I don't want to get anybody in trouble. But, so that's more what I see. I've heard it quite a bit from Middle Easterners that live and work here. They're nurses and doctors, that they have experienced bullying from other races and cultures that have come to Sweden. But I think the Swedish people, generally speaking, as a whole, you don't see that quite so much, which I'm grateful for. Now, I'm not going to say it's 100%. Of course, there's always outliers. I know some people are going to say some stuff in the comments. Nothing's 100% in this world. But that's my experience when it comes to bullying here. I don't really see it quite so much here as you do. I think a big part of it is the fact that in America, there is a hierarchy. There is a pecking order in the healthcare system in America. And so, it just kind of, they say crap rolls downhill. And that's kind of what happens. And that's what this article kind of points out, and several other articles, is if you want change, it's going to have to start at the top and come down. So if there's issues at the top, it's going to go all the way down. That's just what it is. So what do you do about this? What are the things you can do? So according to this article, here's some strategies for addressing bullying. So first of all, you're going to have to admit that there is a problem. And if possible, then you need to eliminate the factors that are making it worse. Could it be that there's a lot of stress going on in the department and fatigue that's bringing out the worst? You got to start from the top. So it starts with leadership. You need to have a zero tolerance policy. So as managers and leadership, you need to call these things out and say, this is not going to be tolerated, and this is the kind of behavior that's not tolerated. You need to be very detailed and explain what bullying is. It may be that you have to get human resources involved in the situation as well. It might be that nurses need to seek behavioral health services. They may need to seek guidance of a counselor. And as nurses, we need to hold each other accountable. If someone starts to bully you, rather than raising your voice and yelling back, you need to tell them the behavior that you don't like. It could be that you just got on the nurse's wrong side. Sometimes it takes a while for us as humans to get used to each other's smell, and we have different styles of communicating. And so it could just be a misunderstanding. A lot of times that's all it is something, a simple misunderstanding. It could be that the person's just having a bad day or whatever. And so it's really important to give people the benefit of the doubt, be patient with one another, but say, hey, when you said such and such, it made me feel this way. And if the person is just going to blow it off, say, you can't treat me like that. I'm going to treat you with respect, and you're going to have to treat me with respect. And then you need to keep a track record. If these things keep happening, you got to cover your butt, and you got to keep a track of all this stuff. And if it gets serious enough, then you need to get the manager involved. You may need to get human resources involved. I've seen these kinds of things get pretty bad. Like I said, I think this is an important topic. Really, it affects everybody, not just us nurses, but you as patients as well. And I'd like to know, maybe you're a nurse or a healthcare worker that works in America and has these kind of issues. Love to hear about your story. Also, if you work in another country, really curious to see what the difference is. Do you have these kinds of workplace bullying among, especially like nurses, in the country where you live? Maybe you're in Sweden. Maybe you've not had as good of an experience as I have had. Maybe you have been a victim of bullying in Sweden. I really am interested and curious to hear about that. But as always, please be respectful. This video was about bullying. There's no need to bully people in the comments. It will not be tolerated on this platform. Hope y'all have a wonderful rest of your day. And I hope you found that this video was helpful. Maybe some of you have been dealing with this for a while and trying to figure out how to navigate all this. So yeah, thank you for watching the video and have a wonderful day.